As of today, June 8th, 2021, 71% of Sonoma County residents ages 12 and older have had at least one shot, and 62% are fully vaccinated. Our overall high rates of vaccination disguise the fact that for young people and those in lower income neighborhoods, the rates remain low. Kids 12 to 15-year-olds are 36.8% vaccinated as of today, and ages 16 to 24 are 56.5% vaccinated. So just under 2/3 of 12 to 15 and just under half of the 16 to 24-year-olds remain unvaccinated. And yet young people are most likely to engage in COVID risky social behavior, which is normal. In the normal times, that would be not a problem, but now that could be a problem. The more unvaccinated people in our community creates a greater risk to all of us. The longer the virus circulates and mutates, the more we are all at risk for variants for which we are not prepared, and which could result in more societal shutdowns. Parents and children will play a critical role in preventing another wave of the pandemic, especially in the fall when school's back in session. Today, we're going to discuss how we can appeal to hesitant parents and to young people who have the illusion of invincibility and what's working out there. I'll start by introducing our esteemed panelists. Please read their bios on healthcarefoundation.net for more information. We have Brian Prustowski, pediatrician at Sutter Health, Jason Cunningham, CEO of West County Health Centers, Sylvia Lemus, strategic communications specialist at the County of Sonoma, Glyden Freitas, CEO of Corazon Healdsburg, Stephanie Manieri, director of programs at Latino Service Providers, Victor Pena, youth promotor at Latino Service Providers, and Sue Labby, chief medical officer at Alliance Medical Centers. So I'd like to start today with Victor. Victor, could you just tell us your story, if you would, about what made you decide to get the vaccine and what you're hearing from your friends?
Perfect. Obviously, I want to thank everybody for having me here again. But there's multiple reasons that made me actually want to get the vaccine. It just wasn't one single item. It was, I guess, a conjunction of multiple things. And it was mainly, I personally actually suffered. I contacted COVID-19 myself, and I spent the week and a half, almost 2 weeks of, I want to say at times, intense symptoms where it was difficult to breathe, having to go to the ER myself. And it was very difficult at times, just even getting up and down the stairs, losing breath. And it was not something just that happened over the 2 weeks. It was something that in the coming months was still difficult just to regain back that strength, that lost strength from the virus. And then after that fact, it was just the notion of knowing that I was a potential carrier and not being able to see my family or not being able to simply, I myself too, I was a graduating class of 2020, wasn't able to walk graduation because of the virus. So it was just multiple life events that really took place that were in a way sadly taken away, I missed out on because of a virus. And personally, I decided to get vaccinated because I don't want that. I want to be able to be in person. I want to be able to hug my grandma and my grandpa if I'm able to see them again. And it was the main reasons that I decided to finally get vaccinated myself, just basically to hopefully get back to a normal life and be able to simply see family and hug them safely.
Thank you, Victor. Is there anything that you're hearing from your friends that would be helpful for us to know today?
Yeah, when it comes to my friends, luckily I've been in a great circle of people that also themselves got vaccinated, but I have coworkers that are younger in my age that haven't gotten vaccinated. And when I hear from them, it's just, a worry that the vaccine hasn't been fully tested. It hasn't gone fully through the process of all the other vaccines. It's for emergency use only. And it's kind of a fear in them of what can happen to me if it hasn't been fully studied yet. There's certain vaccines that have taken so many years to finally come and be production ready. And in a matter of months, the COVID-19 vaccine was ready and started being used. It was kind of a worry. And that's kind of what's going on, I guess, to many youth. And then to others, it's get me this vaccine as soon as I can because I want to live a normal life. So it's kind of an either or basis.
Thank you so much, Victor. Would anyone like to address that particular question around perceived speed with which the vaccine was approved under emergency provisions. I know that there's a different perspective on that. Jason or Brian, would you like to address that?
What do you think, Jason? You want to tackle that one, or how about I get started and you join in?
Sure.
Victor, your experiences, thank you so much for sharing that with all of us. I feel like those personal anecdotes of particularly having had been through the experience of getting COVID, it's so important as a reminder, because I think that right now, as a lot of folks are kind of moving towards this era of, wow, we've been doing so well with vaccines that we're now particularly, I think, as Kim had mentioned, over the 70% mark. It feels like there's a little bit of a, oh, okay, well, it's done, but people don't know or remember that if they're unvaccinated, at any point, they could still have that same course you experience. It's like super, super helpful. I hear in my office from a lot of folks exactly what you mentioned, that some of your coworkers have said about emergency use authorization, feeling like it's not full authorization. And then I also hear that same question frequently about the speed at which this vaccine was created. So just to dive in briefly, emergency use authorization and the speed at which the vaccine were created was a global necessity. And I think that on some level, everyone can kind of understand that under pandemic circumstances, things move a little bit faster. And a lot of that has to do with funding and intention. So when you talk about development of vaccines, just in terms of the history of vaccines, a lot of the holdup, if you can imagine it, often has to do with getting people to be willing to be part of a study. And that phase 3 trial can take years to get enough people to say, you're kind of trying to recruit this population of folks to say, I'm not sure that this vaccine is safe and effective, but would you be willing to be part of that experimental group? For some folks, that phase 3 trial, really to build it, can take 8 to 9 years. So when you're talking about that just duration of time to get like a courageous group of people to study a vaccine, 2020 was a total unusual year in that within 3 months they were able to get 85,000 people to sign up. So that's just not typical. And so I think that number one was a big part of why this process in terms of the phase 3 trial could happen so quickly. The science wasn't rushed. It was the recruiting that just happened faster than previously. The other thing that not a lot of people talk about is that, oftentimes in the news, they call this SARS-CoV-2. Well, SARS-CoV-1 was in 2003, and it was mostly in Asia. So a lot of Americans were not personally affected unless they had family out there. But after SARS-CoV-1, they actually started making this vaccine. And at the onset of the pandemic, they modified it once one of these gene researchers left Wuhan on a plane in January of 2020 and texted around the world all of the folks that were in his sort of gene research world to be able to modify the vaccine, to make it so that they were able to have this jump kind of the phase 1 and phase 2 part and jump right into phase 3, because there was initiative, there was money, and they were able to get lots of people who were just terrified that this disease was going to be the end of them. They wanted to be part of the solution. So that was part of the speed part of it that actually didn't impact the science. It was just, that's why it was different than previous vaccines, if that helps.
Thank you, Brian. Jason, I wanted to ask you, you're involved in county-wide vaccine efforts. Can you talk a bit about the recent pivot to mobile and pop-up clinics and how that is working with kids and vaccines?
Yeah, sure. I'm thankful for that question, that earlier question that Victor brought up, and Brian, I'm thankful that you answered that. Nice work. I do want to just comment on that too. The funding was a really important part of this transition. Most of the pharmaceutical companies, without funding that we received from the federal government to allow them to assume that risk, that if it didn't work, they wouldn't be out that much money. That assumption that they were going to purchase millions of vaccines allowed the pharmaceutical companies to move quickly at some of the requirements for vaccinations. And that was a significant leadership decision that has benefited the world. The other thing I think it's really important to say, I think we're going to look back on this year as one of the pivotal moments in all of medicine, that the mRNA technology, that ability to quickly take a material that we know about from a gene pool or a scientist to be able to identify a variant and then put that into a vaccine and produce the vaccine quickly, they will start using this for our own medicine. If you have a cancer, for instance, it is not unheard of for us to think that we could take some biology from that cancer, make a vaccine quickly, and give you a vaccine against that cancer. That's the type of transformational work that's happened around these vaccines. So I do think that what Brian's getting at, we've moved quickly in here because of the opportunity. And also this is a very unique opportunity for all of medicine moving forward. It's kind of basic science is saving the world, which is really interesting. I'm really interested in leadership and the ability for us to take systems and move them to the benefit of the common good. I work for a community health center. That's one of the passions I have around achieving that. And collective action, being able to do this collectively, where not one organization, not one individual can make a difference. We had to do this together. I think is a really, it's an interesting reflection that we're all going to have. I think this is where most of us would say this is probably the most important thing we will have ever done in healthcare, or we will have ever done for our community, and be proud of that. In the beginning, if you look back on it, it was a lot about, there was a rise in the cases and there was a scarcity of vaccines. We had to be efficient in getting the vaccines into as many people as possible so we could reduce that curve, and it worked. The number of death rates, the number of deaths and the number of hospitalizations plummeted once we reached a certain vaccination. And it really required us to do these in these larger centers because we had a few number of providers who could get the vaccine, store the vaccine, and deploy the vaccine in order to do that. And if you can remember, there was all sorts of times we're gonna have this much vaccine and then not that much. We needed to have larger organizations do that in an efficient way. That's changed. And so the number of vaccines now outstrips our demand for those vaccines. And so the requirement for us to have those large sites has become less important. And that's one of the reasons we're pivoting. I would say though that the need for us to do vaccines in communities with trusted messengers in a way that people can have honest, authentic conversations about their concerns in a way that people feel comfortable has never changed. And I think the pivot, if we could have done it all over again, we would have started with that and had many small pop-up vaccination community-centric clinics to be able to do that. So looking at Stephanie and Victor and Gladen, and Sylvia's work, Sue's always doing this stuff up in Healdsburg, but that concept that we're going to actually rely on those who are connected to our communities, who are trusted, is a much more relevant way for us to meet the needs of people who might have concerns. And so that pivot is really important right now as we get into that. And teens, all the more so. So I think that's how I would say we're pivoting to something that we already should have done. We just didn't have the ability to do before. And we're learning the skills around how do we work with those who are truly connected to our community to be a better vaccinator.
Thank you. Glyden, can you talk a little bit about your work with Alliance, filling so many appointments over the last 4 months? Is your call center still operational? And what are you hearing from clients and particularly parents about the vaccine?
Thank you very much, Kim, for this question. And it's been an incredible partnership that we are having, both with Sue here representing Alliance, and also Jason representing West County. And I think that was very, very good for our community and for our partners too. So we help both Alliance and West County with outreaching the community members in a one-on-one base and in a very community relationship base, right? I think that work was very important, right? To gain the trust and to have someone who speaks not only the Spanish language, but the cultural, culturally appropriated, right, with our community, and taking advantage that the trust and that we built for all those years. So the way that they happened, Alliance and West County would share with us their calendars and their clinics and the number of vaccination or vaccines available. We would generate a list both from our partners and from Alliance and our internal list, and we would call every single one in that list to make appointments and to make sure that all the information is in the system and to make sure that this person would go to the vaccine for both doses. Right? That was it was a very good tool for us to even strengthen our relationship, our relationship that Corazon have with our existing clients, but with potential clients that will come to Corazon too. This partnership would not be successful as it was if Alliance and West County were not ready to receive our friends, our families, right, in a very dignifying way at the clinic. So they were also not only the outreach and the invitation to come to have the vaccines, but whenever these clients or these people that we outreach would go to the clinics, Alliance and West County made sure that they have translator, that they have people to welcome and to help them, help our clients to navigate the system and to encourage them to know that they were in a safe space. So it was very successful. We received a very, very good and positive feedback from both of our partnerships. And yes, we still have a little bit different now. We are receiving some inbound calls and educating the clients and trying to navigate what the available clinics that are now. But now they are reaching out to us, right, and are advertising, and we're still having this partnership. And 3 or 4 people working on that in different schedules to make sure that the people who are not vaccinated still have access to this ongoing clinic. Some of the questions that we have been receiving from our clients, especially now with the kids, is about side effects, right? What's the possible side effects that the kids or the minors would have, if that's in the proportion of side effects, or is that comparable with the other age groups, or it is stronger, or so it's not only in the number of incidents of strong side effects, but also what's the strength of the side effects if hits the kid, right? There's questions that it goes only by side effects, but also about infertility, or about death, about what can cause, for example, for a young girl that didn't have her period yet, is that going to cause any hormone right problem, or any kind of interference, right, in the regular development of the kid. So this kind of growing hormonal fertility, there's questions about all of those things, but basic on the difference, and also vector, right, how the kids can be a vector, or if it's a vector for the disease if the kid is not vaccinated, and so on.
I think that's a perfect setup for Sue. Sue, would you mind addressing those issues about is it dangerous for kids? Does it affect their fertility? Have there been any deaths from the vaccine? Do you want to address some of those questions? I'm sure there are many parents out there are interested. And also, one parent asks, what about the increase in hospitalizations among teenagers? There was a Washington Post article about that recently, if you have a chance to answer.
Sure. Yeah, I mean, I've been talking to the parents that I see in clinic throughout the whole COVID pandemic about the very real risks of COVID specifically, and how, there's kind of a misconception out there that children don't get sick with COVID, and that for that reason, people are less likely to get their youth vaccinated. And the reality is children do get sick. And thousands of children across the country have been hospitalized with COVID. Children have died from COVID. Children have long-term ongoing symptoms from COVID. There is several incidences of what's called multi-system inflammatory syndrome, which has basically as a result of children's very strong, robust immune systems responding in such an extreme way to the COVID virus that it actually attacks their own system. And so what the conversations that I'm having with parents on a pretty much a daily basis is more focused on what the real risks that we know exist with COVID and what that can mean to their child, and how can we partner to protect their child. And looking at, just like I would have a conversation about any other infectious disease and how that poses a risk to the child, I have those same conversations related to COVID. One of the things that we know about the COVID vaccines that are available to children is they are very effective in preventing the spread of the COVID virus. In fact, much more effective than many other vaccines that are out there on the market. And so even our annual flu vaccine, which many of my families don't even think twice about getting, is not nearly as effective as the COVID vaccines are in preventing that infection. And the severe side effects that make news from the COVID vaccines are very minimal in the sense of the frequency. So like less than 0.5% of those millions of individuals that receive the vaccine. They're rare, they're treatable. The minor side effects, which is much more common, are actually a positive thing. They're a sign that the healthy immune system is responding to the vaccine the way that it should. Creating an immune response so that if they are exposed to the virus, it can help to fight that off. A lot of what I get is, well, will it, I know somebody who got the vaccine and they still got COVID. Well, no vaccine is 100% effective. And so there are going to be people that may get COVID, but the reality is none of the participants in the studies got COVID post getting the vaccine and were hospitalized or died from COVID. So that 5% that may have gotten it actually probably got a much milder form of COVID. And so no vaccine is 100%. Although I can say that in the trials that were done in the 12 to 15-year-old range, the trial participants actually showed 100% efficacy. Now, I think that as more children get it, you'll see closer to that 95%, but those trial participants, none of them actually got COVID. So looking at, I think the more important conversation is the very real risks of COVID infection versus the treatable risks of side effects with the COVID vaccine. Oh, you're muted.
Whoops. Do we know of any cases of a child dying from the COVID vaccine?
So,
I have not heard of any cases myself, but
So I don't know of any, but I'm gonna actually maybe punt that question over to Brian if he can speak to that.
High five, Sue, through the Zoom. Nobody has died from the Pfizer vaccine who are kids that we're talking about. I think one of the things that a lot of people bring up, just to kind of add to what Sue's saying, I 100% agree with everything she said, is people bring up the VAERS system, the Vaccine Adverse Events Reporting System that's public. And this is where a lot of folks will kind of bring up concerns about that they may have seen in their practice, or and there's the reason we want that to be as transparent as possible is we want our governing bodies to help us sort of siphon through some of these concerns to see whether or not there's any credibility to them. And as Glyden had alluded to, some of these allegations that people make, I just want to, Sue can speak to this too, and I'm sure Jason as well as a family doctor, are not actually new concepts of sort of like the anti-vax community, and not that people who are scared of the coronavirus vaccine are necessarily kind of, on extreme anti-vaxxers. But this concept of infertility is not a new allegation. That's one that we've heard for many years about vaccines. And the reason that's a popular hypothesis that people come up with isn't specific to coronavirus vaccine. It's that it really hits personally for a lot of people. And one of the things that the kind of misinformation campaign is very good at is bringing up personal anecdotes that are broad covering, broad sweeping, so that everybody who reads it is like, oh my goodness, should I be scared about this with myself? So if you say anything related to fertility, that hits younger women, that hits, women who are actually of fertile age, and it hits grandmas who are thinking about their kids' fertility as well. So basically everybody is scared of anything that might have any issue with fertility. There's nothing about the coronavirus vaccines that we have as far as scientific data to suggest that there's any issue related to fertility. It was like, again, one of those old anti-vax arguments that was just resurfaced, and it always makes people scared. But they're just glad. And when people ask you in your phone calls with them about, is there any truth to the infertility piece from the scientific side, you can say to them confidently, there's really no data to support that. That was an old argument that people have resurfaced and used for quite a while. So the same holds true with the question that you brought up about the impact on menstruation. Again, as far as anything related to women's health, people will make hypotheses and allegations because, again, broad sweeping, it affects a lot of people. But unless I would want to be the first person in my office to know if there was actually any truth to any of these allegations, because of course we would want to be honest with our patients as doctors who sign up to say, do no harm. That is our commitment to our community and to the people who are in our families and our friends. We would want to be the first ones to know all of that information so that we could keep people safe. None of that has been communicated to me, I could say, as a health professional, although I have seen a lot of it on the internet, and a lot of my parents have come in and teens and said, is there any truth to this? And as Sue had said, just to kind of piggyback on that side effect question that you mentioned, Glyden, teens, and Victor, I know you're kind of out of that range, but teens live in the moment. They care about what's going to happen to me today, right now. They're not thinking about what's going to happen to them years down the line. So side effects, when I was in one of those health fair lines, when we got to go to Wright Charter School, and I was just kind of being a cheerleader as people were hesitant and like, I want to get my vaccine, but I'm still scared. Almost all of the questions, as you said, Glyden, were about immediate side effects and side effects after the second vaccine. So much so that I've actually even heard people, and maybe you guys could speak to this too, bring up the question about, should I try to get a different second vaccine just so that I can kind of like mitigate some of that potential side effects, which there's no data to support that that's the strategy that has as much to support it for now. So we really do want people to get Pfizer 1, Pfizer 2, Moderna 1, Moderna 2, in case that question comes up as well. But a lot of the things that you're bringing up, I mean, it's just the internet has exploded with all of these fear-mongering things that spread so quickly. And personal anecdotes, this is why, Victor, what you were saying at the beginning of this is so important, so that people can hear that anecdote of, well, this is what it feels like to get COVID. It doesn't feel good either. Like the vaccine, I just didn't want anybody to go through that. I want to hug my grandparents. It's so important. I appreciate your perspective so much.
Thanks. Thanks, Brian. Stephanie, I wanted to ask you, tell us a little bit about what Latino service providers is doing to get the vaccine message out to the youth in your community.
Thank you for that question. So Latino service providers, in partnership with other community-based organizations and partners from federally qualified health centers and the county, have been working really diligently to message specifically to youth. And really our strategy has been to have youth lead these efforts. So youth like Victor and others who have really become ambassadors of this messaging within their own spheres of influence. So whether that's with their friends or with their family, we have a cohort of 46, 47 youth community health workers at Latino service providers. We run a youth community health worker program. And we were really fortunate to partner with the county early on in January to make vaccines available to our youth under that one of those first tiers that community health workers were eligible under. And so our youth really early on became educated about vaccines, about COVID, about side effects, and then they were able to take that information and share it with whoever was near to them. And so really a lot of our efforts have been resourcing our youth, making sure that they're a part of designing events and being a part of health fairs, like the ones Dr. Prostowski was just talking about. So our youth are out and about and with us wherever we go. And a really big part of that was having access to the vaccines really early on. And so we're looking to continue to do this work. We're trying to find other ways of really reaching youth where they're at, whether that's online or in person. We know that things are going to be shifting as things open back up in our county. And so we're preparing for that and making sure that, again, we're bringing our youth along with us and that they're really leading these efforts.
Great. Thank you so much for all your work, Stephanie. Sylvia, do you want to tell us a little bit about what you're learning about messaging to teens and parents?
Yes. At the county, we've been busily working on the vaccine and shifting. More recently, we shifted over to youth messaging and vaccines. And so one of the things that we learned is we really don't know how to communicate to youth. So we're really working with our trusted partners and doing everything we can to learn and glean information about how to best reach youth. There are some efforts that we have been trying. For example, we've been collaborating with SCO and having pop-ups at like LC High School, Sonoma Valley High School, some different schools to have like school-based type of vaccine opportunities for youth and their families. And so some of those have had events like pizza. Lately, we've had incentives such as C's candy giveaways. So different type of incentives to try to help bring youth and their families out to get vaccinated. So that's just an example of some of the things that we're doing, but the messaging also. We have an Instagram account that, believe it or not, we had not used very much in the last 4 years. And so we're now going in there, updating posts and trying to add additional posts for youth. And so I did want to share a little information if I could, and then I can share some more information down the road. So I wanted to share, and I know that you did share some of the information around. Let me get to the share button. Here it is. Some of the information on vaccines. Screen one. And share. Okay, so. As you mentioned earlier, Kim, we now have 562,000 doses administered. And so we actually now, as of today, have around 75% of the county population ages 12 years and older, at least partially vaccinated. We have around 65% that have been fully vaccinated and around 10 or 11% that are partially vaccinated. So we are, as you can tell, that we are kind of moving towards that goal of fully vaccinating or getting more to a herd immunity here in Sonoma County. But as you can see in this slide, initially we had a large group, and our over 70 and 75-year-old are at least partially vaccinated at 91%. So that's here. A high percent of the highest percentage of people that are vaccinated are people that are in older generations. And then those that are in the 12 to 15 are at least half or at least partially vaccinated. So one of the things that we're seeing, I know that there's a lot of questions about the tiers, and we're in the orange tiers. We had hoped to go into the yellow tier, but we are seeing still COVID cases here in Sonoma County, and most of those are happening in the younger generations. And so, as you can tell here, up to age 34, there is still a large percentage still needs to be vaccinated here. So we are working on trying to get more and more people in our younger age group vaccinated. And here at the county, we're trying to do as much as we can to spread information on getting more vaccination. Here's another slide I wanted to share. This next slide shows kind of a different type of a graph where you can see there was, with some of the other age groups, here's age groups, there was like a slower kind of trend up into getting to the high vaccination. But with the youth, and maybe that could be because the parents were engaged in vaccinations, we had a very high jump of vaccination in youth, 12 to 15-year-olds, which I thought was very interesting. But we're not sure if this might have been because we were working with SCO and schools and targeting youth while they were in school. And maybe over the summer, we might see a little bit of a plateau, but we still want to do as much as we can in efforts to try to reach more of the younger ages, the 12 to 15 and even up to age 24, to try to get more and more of our county vaccinated.
Great. Thank you so much, Sylvia. We've had a few questions I want to just put out there. Let's see. We didn't address the question that came up earlier. And does anyone feel able to answer this one from an audience member. What are our thoughts on the increased COVID hospitalizations among teenagers? Is it related to variants or vaccination rates among teenage children? I think there was a recent article about that. I was just looking at that today, and it sounded to me like it was about the variants and also about the low vaccination rates among teens. But anyone have a comment on that or able to answer?
Sure, I can comment on it. So yes, we do know that with the variants, some of them are more highly transmissible. So as teens are gathering more, returning to in-person sports, in-person school, the likelihood of those variants being transmitted amongst teenagers is certainly higher. We also saw that our vaccination rates in our youth is much lower than in our older population. So the likelihood that they will be exposed to individuals that are potentially COVID positive with higher transmissibility of the variants in those populations is greater. And as I mentioned before, children can get sick with COVID. So it's not, it's not something that that everybody is going to walk away with thinking that the youth are immune to it, because youth are getting sicker, youth are being hospitalized. And the article you're referring to in the Washington Post, where you saw a rise in April and March of youth hospitalizations, specifically is, I think, related to this and the increased variants. What we know now is that the variants that we have found are still those who get vaccinated, those variants are still preventable through the vaccination. But we need to be vigilant. It's really important that we get our youth vaccinated, because as you mentioned kind of at the top of this, is that the more time that the virus circulates among unvaccinated people, the more opportunities it has to mutate, and the higher the likelihood that some of those mutations or variants could develop, could become resistant or have a resistance to the vaccines that we currently have, which the good news is that's not currently the case, but the quicker we can get folks vaccinated, the less likely that is to happen.
Thanks, Sue. Also, a parent asked, and I don't think we specifically addressed the question about asthma and whether it's safe for a child who has asthma to get the vaccine. Can you answer that, Sue? Oh, and maybe Brian?
Yes, absolutely, it's safe. So in fact, a child with asthma would be one of the children that I would advocate kind of greatly for parents to get them vaccinated, because we know that children who have asthma who get sick with COVID have a much higher likelihood of having a more serious course and having prolonged symptoms, even post-acute infection. And so that's definitely a specific conversation that I would want to have with the parents of any of my patients who were asthmatic, and why it's so important to protect them by getting them vaccinated.
Thank you. Jason, let me ask you this one that comes from another listener. Has the vaccine been modified from the first one due to allergic reactions? I think they may be talking about the Johnson & Johnson, or can you speak to any changes that you know of in the vaccine? I'm unaware of those.
No, my understanding is there hasn't been any modifications to the vaccines. As Brian was saying, that the VAER, the ability for us to identify those side effects and to be able to say, is this something we should continue to move forward on? I was very thankful that the FDA and the CDC put a halt on the Johnson & Johnson. I think that was a really good example of us being honest about, is this that we're putting into the community safe, and the determination after lots and lots of discussion and study was that it was safe. Then we went forward again, but none of the vaccines were modified from that. I can imagine in the future modification of the vaccines, particularly the mRNA vaccines, because of variants. I can imagine that being something that would happen in the future, but no changes from the vaccine.
Thank you. I'm wondering if any of you have had any conversations with a parent, and Brian, this may be for you and anyone else, who has been hesitant, and how you and then decided to go ahead and have their child vaccinated. Can you share an anecdote that might be useful to our audience?
Sure. Victor's, I liked his better though, but I think one of the things that I've learned about vaccine hesitancy, and I appreciate the focus on the personal, Kim. Let me kind of say one thing about vaccine hesitancy first, is that I think this is a little bit different. Sue and I are so used to, and Jason, like kind of people kind of coming into our office with preconceived notions about vaccines that they may have heard because the vaccines have been around for a long time. And I think that like the concept of the culture, I know that Glyden used that word initially, like the culture within which a person lives is really significant about what's like the normal behavior. So Jason, working on West County, we know that statewide, even 2 years ago, happened to be that West County in the state of California had some of the lowest vaccination rates in all of California for children entering kindergarten. And it was a really big deal at the time to try to think about culturally, how can you kind of even begin to have a discussion in an environment where it's almost like it's become like polarized such that there's like value-based values kind of applied to whatever decision that you make. Like you are good if you don't get vaccinated, you're bad if you get vaccinated, or like safe or unsafe. So one of the things when people come into my office and they kind of come up with one of these things that they've heard that Glyden had listed out so clearly, which are common, is that people are scared. And I think that one of the things as a professional, when people come to you when they're scared, to remember is that it's when people are scared, they don't really hear numbers or data so well. Oftentimes, we don't tend to, we have these quick visits. So we tend to be like, but didn't you hear that, you know, this is safe now? It's okay. The Johnson & Johnson vaccine is no longer on pause. They're still scared. And so I think that on our level, like our responsibility as health professionals, I think, is to validate that this whole year has just been terrifying. Coronavirus has changed our lives forever. There have been some silver linings. We were talking about Zoom meetings, panels like this, but I think that functionally, for a lot of people, this has been a really terrible, difficult year. And when they come into the office saying, but doctor, I'm afraid about getting a blood clot if I get the Johnson & Johnson vaccine. However many, however unlikely that is, given that it was kind of 1 in a million chance, it's still a reasonable thing to say, this whole thing is super scary, and I'm so sorry you're scared. Because I think that when people are scared, they can't hear data. They have to be nurtured. You have to kind of say to them, I feel like this whole thing has been scary. I'm here with you. It's scary. Just like honor that people have real fears. And only then after you kind of agree on this intention of safety. So they're saying, I feel unsafe by the vaccine. And you're saying, but coronavirus disease, as Victor had said, is unsafe. It's uncomfortable. It could, you know, as Sue had said, you can be hospitalized and get really sick, even as a teen, from coronavirus disease. We're saying we don't want you to have any harm. They're saying, I don't want to be harmed by the vaccine. You can actually, your first conversation around vaccine hesitancy can actually be to align on an intention of safety. They want to be safe. You want them to be safe. So long as you kind of start together at that starting point, most of the families that I see that show up in my office and say, I'm just scared. If you don't kind of say, I hear you, a lot of times what happens is you'll say, but the data don't show that. And they'll say, but what about this? This is also scary. But what about this? This is also scary. And there's a lot of scary things, like Layden had listed like 7 scary things, like, but what about my fertility? But what about my menstruation? But what about like, you know, side effects? You know, it's like they just jump from it because literally when you're scared, you're just scared. So you have to kind of find your common ground to say, hey, this whole thing's scary. We both actually want what's safest. Let's see where we can kind of go from here moving forward once everybody's like fears are kind of a little bit de-escalated and we feel like we have the ability to have like a conversation in a safe, secure environment. We're lucky enough, I think, Sue, myself, and Jason, to have a lot of these conversations in our like sacred office room, which is a place where people can be vulnerable and trust us enough to come to us, which is not the same as Glyden or as Stephanie or as Victor or as Sylvia. A lot of times we're trying to create that rapport over the phone with somebody, which is why it is so important for us, I feel like as health professionals, to like support them as much as possible whenever they need us, like to answer a medical question that's come up in a conversation that they've had. This is where this sort of partnership of how can we, like, as Jason said, kind of building like this concept of like systems leadership and collective action can have really the greatest impact, particularly at this phase of the pandemic when we're thinking about how are we really reaching broadly for people who are scared and who might be in an echo chamber that is saying to them, please don't get this vaccine because I don't want you to be infertile. And if they're not hearing from anybody that they trust that actually this vaccine can save their life, they may not decide to get vaccinated without that personal touch from somebody like Victor or like one of Stephanie's promotores that can really kind of have that impact on their peers. So it's not a specific answer to your question, Kim, about like how to navigate vaccine hesitancy, but in a general sense, the first step of aligning on an intention of safety and trust is kind of everything.
Thank you. Victor, can you speak to that? Have you found your way through conversations that were challenging with any friends who were hesitant, and were you able to make them feel more comfortable?
The way that I've talked with, especially I guess coworkers at work, about COVID has honestly been my personal experience actually having the virus. I tell them, it's at the moment you haven't actually had it, you haven't gone through the symptoms, you haven't gone through the side effects of it. And then I tell them it's not a joke, it's a real virus that me as a healthy teenager who works out, who lives a normal life, was struck down up to days where I really couldn't get out of bed myself. I'm like, you're in better shape than me, and or even in worse shape than me, and it's something serious, and I'm looking out for you, and you got to understand that this is a real virus and that this vaccine is here to help you, and you got to understand this is just a serious thing, and it's not really a joke, and that we have to really take everything, especially as our medical experts are telling us up front that yes, it is serious and that it has been tested and that we really need to get vaccinated to come out in a better future.
Thank you, Victor. Stephanie, oh, and go ahead, Jason.
I just wanted to add a little bit on to Brian's point, having conversations all the time with interested patients and family members. And I agree that there's a need for us to say, it's okay to be concerned. It's okay to be authentically concerned about the vaccine, particularly as parents. It's important for us to take that stand of advocacy for our children. So really opening up that space to say, because you're concerned doesn't mean you're bad or that you're an anti-vaxxer or that. So that conversation, creating that safe space is really important. One thing I don't hear us talking about a lot is the impact of COVID and isolation and shutting down on our kids. And I think that's really important for us to talk about. So that I call them the shadow diseases when we're talking about decreased support for children who are exposed in the home to addiction or to abuse, to not having learning in the schools because we're having distance for our most vulnerable populations who can't get to school, who have single parent households or have multiple family members who are working, who the kids don't have access to their learning. We need as kids to be social. That's part of our development. There are so many aspects of the COVID that I can't tell you how many conversations I'm having with parents about suicidality and with cutting and other things because of this. And I think it's really important as parents for us to recognize that the isolation and the impact that's had on our children will have lingering effects for generation. And that our ability to advocate as parents and as healthcare systems and as community benefit organizations, community-based organizations, to make sure that we're immunizing or protecting our children, this is somewhat of a vaccine preventable outcome, if you think about it. So our society, if the virus comes back into our community, we will shut down to a certain extent. Those who have the vaccine will have different access to activities than those who don't. That's how our society should be protecting our most vulnerable. So those individuals who are not vaccinated will have less access to coaches and teachers who will be supporting them, to school, to food. Sometimes it's the only source of nutrition is our schools. And so for us not to allow our kids back in schools because they're not vaccinated is a tragedy to me. So I think we need to really recognize that we're protecting our children against all the aspects of being a kid by vaccinating. And so that's one aspect that I think is something that we should be talking about, not just about the science of the disease, but also the impact of our disease on our children and how, if we give them the vaccine, we're protecting them, to giving them the most opportunity that we can to participate in societies.
Great point. Thank you so much, Jason. Stephanie, would you like to share anything about your experience talking to people and anything you're hearing from your own experience or your promotores?
Yeah, I think a lot of what's been already been shared is what we're hearing too are valid concerns and fears for around the vaccine, and I think that it's really important that as a community we're not guilting or shaming anybody into doing something that maybe they don't want to do, and especially in the undocumented and Latinx community, which is really the community that we work with. There are valid reasons to fear healthcare and healthcare providers. There's a lot of historical trauma that we need to be aware of. And so really the message is that we want to send to the community is that it's okay to ask questions. It's okay to seek resources and information. And if you're not ready, how can we support you in still being safe? How can we still make testing available? And how can we get you masks if you don't have masks? So we're really trying to come at it from a holistic approach and see the family for who they are, the child for being a child, and really I just want to elevate what's already been said is that it's okay to ask questions and have those concerns, and really what what Victor is doing with as being an advocate and sharing his story, that's really important too. And so, if those of us on this call or anyone listening in, I think it's really important for us to recognize that maybe we have our own stories that could be impactful, or that might be able to change some perceptions, right? So I'm kind of making a call to action, I guess, for those of us here listening, to talk to our friends and our family, because those personal relationships are going to make a much bigger impact than maybe even a conversation with a doctor, especially in communities that are really hard to reach and to really not work with, but to make sure that they trust. It has to come from trusted messengers. So yeah.
Thank you so much. I would love to just hear from all of you one at a time what you're feeling optimistic about. So I'll start with you, Sylvia. Is there something you can say in your experience that you're feeling optimistic about?
I feel like, summer's here and we're really progressing as a county with vaccination. So I'm really optimistic about that. And I'm very encouraged that we're working together as a community to try to continue vaccinations and increase our numbers here. And just, the partnerships that we've developed and continue to develop, I'm encouraged about that as well. So that's something really positive that's come out of this, where the communities come together.
Thank you. How about you, Glyden? What are you optimistic about?
Oh, as even we see some fear, even though we see some questions and all relevant questions. I think as more as we work with the community become automatically an advocate for vaccinations, and it's not the responsibility. It's not only on our shoulders as providers, as service providers, but the community is absorbing this responsibility and even more believing in the system, believing on that. So I think we are going to this. We are winning this fight, right? This battle against the COVID, and it's very beautiful to see the community united. So I'm very hopeful that we continue to work with the community, and that out of this pandemic, we leave this pandemic much stronger than we started a year ago. So that's what I'm hopeful, that this community building experience.
Thank you. How about you, Sue? What are you optimistic about?
Well, I would actually like to really echo what Glyden just said, as far as, I think one of the silver linings that's come out of this pandemic is the amazing work that that Sonoma County has been doing, the partnerships that have formed in really kind of rapid fire. We all sort of had to take a leap of faith and trust each other and move forward and do what was right for our community. But I've been so impressed. I always knew that, I loved Sonoma County, but I didn't realize the resilience that was here until I've, over the last couple of years, watch these community-based organizations and these health centers come together to do what's right for this community and to protect our community. So I'm really excited about the work we've done to get through COVID and what that means for the future, because there's still needs that need to be met. Jason talked about kind of the hidden outcomes that have happened because of COVID and what that's going to mean to our youth and how that's affected them. And I think that the work that we've done together as a community to help protect our community members from COVID, we can continue that work to meet those needs and to try and identify where those needs are and mobilize our teams to get there. So I'm really optimistic about what that looks like. You know, on a more superficial basis, I'm really optimistic about getting together with friends and family. I think that day is coming when I can gather indoors without a mask and hug people again. You know, but it's going to take getting everybody vaccinated and being able to be safe to do that. So I do think that day is coming. I think we've done amazing work so far, but there's still work to be done. And I'm really looking forward to that next chapter.
Thank you. I think that cues you up, Jason, and then we'll just go around to everyone else. What are you optimistic about? And between you two, I think, Sue, Alliance vaccinated over 13,000 people. And Jason, I'm not sure what your numbers are, but I'm sure they're quite high as well.
About the same, exactly. Yeah, and small communities, which I'm proud of. One thing is I have a 12-year-old, a 15-year-old, and a 17-year-old, and all three of them are vaccinated as of Saturday. And I can't tell you, there was a relief just as a father that was. So I can say, just as a personal note, I'm thankful for that. I am really interested in this dynamic of partnership and collective action. And I would say there's an element of equity that I think we've learned a lot about, just listening more and understanding more. But I have a lot of hope that that'll impress upon us when we're talking about emergencies and other aspects. So I'm very thankful for that.
Great, thank you. Stephanie, how about you?
I'm optimistic by all of the amazing work that I get to witness our youth do in our community. And so I think that as we move into the summer and a lot of really important work being done around youth and vaccines, I'm just optimistic. I look forward to whatever it is that they design and lead in our community. So, and that makes me optimistic for the future. It makes me excited to kind of step into whatever is going to come next in our community, even though that might seem a little bit intimidating, right? Like fire season and who knows what the next thing in our community will be. But I'm optimistic that as long as our youth are at the forefront of it all, that we're going to be okay.
Thank you. Brian, do you have a moment, and then you, Victor, after that to close it out?
Okay. I just, before I answer your question, I did see that Connie O was asking that question about the myocarditis concern with the Pfizer vaccine. I just didn't want to jump over that because this is, as a Q&A, this is probably more important than.
Sure, go ahead.
Oh, did Jason just answer it? Oh my God, you're so fast on that uptake. Okay.
Okay, Connie, I think we got you in the chat. If you can go ahead and read Dr. Cunningham's response there.
Yeah.
So what are you optimistic about, Brian?
I agree with Jason. I agree with the both. I honestly, you guys, I feel like we were talking a little bit in the preview to this meeting about, like you guys were talking about Sonoma County partnerships. And I feel like one of the things that's been so just wonderful about this new era of communication is that I really hope that somehow everything can just continue to move forward. I know that we want to kind of, as Sue said, get back to our families and our gatherings. And as Victor said, hug our grandparents. And as we're all vaccinated, I feel like that's more possible. But as this sort of new way to think about medicine, think about communication, think about healing, I love teaching. And I have never given this many lectures to outside of my like the sacred exam room or the confines of my office than over the last 6 months. I've been able to talk to Glide and Ed Corazon, to the Latino service providers, to folks in all of our respective organizations. And I just feel like for myself personally, I like that this new era of communication is going to allow us to just be one more global community, which is where I think that as we do well in America with the vaccination campaign, I hope soon, very soon, we could start to influence the rest of the world as we're fighting the pandemic, which feels like there's a big ethical piece to that too. So I'm optimistic about how the rest of the world, after we continue to do this work, is also going to do better with taking care of coronavirus disease soon enough.
Thank you. Thank you, Brian. How about you, Victor? What are you optimistic about?
So first off, I'm very optimistic, obviously, to go back to what normal life is, or what the new norm of life will be. But secondly, I'd like to echo what Dr. Pedrosky was mentioning to us, is that I'm more optimistic about how youth has really, I guess, grown over these couple of months of COVID, in the sense that before we didn't really have these opportunities of sitting at, I'd like to say, on expert panels as this one, because either we didn't have a title, or just youth wasn't really, I guess, considered of importance or up to that certain moment. But now it's, we have youth really taking up these leadership positions where we're able to speak with these, I guess, qualified experts in certain fields. And I think it's not just happening here in Sonoma County, if not nationwide, where youth are taking bigger steps over Zoom and over digital communications to really just give their point of view and have a bigger voice when it comes to building a better future for our communities.
Thank you. I too am optimistic about the youth, and especially meeting you, Victor, and you, Stephanie, and all the people on this panel that are committed to health in our county, and we're doing pretty well. So thank you. I just want to say thank you to everyone. We're going to go ahead and share the upcoming vaccine, or ways that you can get a vaccine, in the chat and also on the screen. I just also want to thank all of our healthcare heroes out there, and donors and sponsors who provide year-round support to the Healthcare Foundation, making it possible for us to give grants to local grassroots nonprofits in the areas of access to healthcare and mental health care. For more information or to contribute, please visit healthcarefoundation.net. And with that, we will say thank you to everyone for joining and sign off. Thank you so much. Have a great evening.